I'm going to show you a few different ankle dorsiflexion exercises that you can do to improve your range of motion for the ankles of your athletes. I use this test, train, retest model. So I'm going to show you the tests that we do and then show you 3 things that you should be doing with your athletes who demonstrate decreased ankle dorsiflexion. And then it's always a good idea to retest after you've done the exercises to determine how effective they were. So the test that we do is this dorsiflexion mobility test, where the athlete stands about 3 inches from the wall and then works on pressing his knee or her knee toward the wall in a straight direction, trying to make sure that the heel stays on the ground and the direction of movement of the knee toward the wall should be straight ahead, if not slightly toward the outside of the foot. So here's again the outline of that test specifically. So you can see on the picture to the left that I've got a measuring tape there just to show you. We want that foot to maintain a perpendicular position to the wall. Oftentimes athletes will turn their foot or externally rotate their foot outward. And in doing that, they can get their knee to the wall, but what that actually creates is a rotary component of the ankle that we really want to try to stay away from. So make sure their foot stays perpendicular to the wall as they press toward the wall. So after we've done the testing session to determine whether or not the athlete has limited dorsiflexion, then we can go into looking at how do we train this. So we use basically a soft tissue mobility, a joint mobility, and then a soft tissue or tissue extensibility stretch. So we'll walk through those now. The first one is the calf foam roll. You may or may not have done some foam rolling in the past, but the idea of a foam roll is to use that device to find these areas of soreness or trigger points within the calf. Once you localize a soreness area or trigger point, then I like my athletes to kind of pump the ankle up and down to really work through that trigger point. Repeat this for about 1 to 2 minutes or until that trigger point starts to release. The ankle mobility exercise or ankle mobilization exercise is a banded exercise. So if you have a band that's about 3.5 or 3/4 to 1 inch, use that around a firm anchor point. Place the other looped end around your ankle and step away to tension the band. And then with your foot flat on the floor, press your knee forward. That band's going to be pulling your distal tib and fib forward as you go into dorsiflexion, which is going to help with gaining range of motion of that ankle. And then lastly is the traditional kind of calf mobility stretch, where you lean in to get a stretch, hold that, and then you pump that ankle again forward, but toward your pinky toe. Make sure that knee is not dropping inside of the big toe. So this calf mobility stretch is great at getting at both muscles of the calf, both the gastrocnemius and the soleus. So that kind of completes that test retest model, and we're going to finish up again with another post-test of our ankle dorsiflexion assessment to see how effective that treatment protocol was. What you'll find is that after this treatment, most athletes who are limited will no longer be limited, but the challenge becomes if they go back to their previous postures and previous habits of what they've done all day long, by the time they come back the next day, the chances are they may be limited again. So what I oftentimes do is those that test positive in this ankle dorsiflexion limitation, I will do this protocol on a daily basis prior to training or practice for at least 3 or 4 weeks. By doing it every day, hopefully we can instill some change and actually improve their ankle range of motion. All right, let me know if you have any questions. I'd be happy to answer them for you. Have a good day.